Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Amoxicillin. Its brand name is Amoxil. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how amoxicillin works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe amoxicillin. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does amoxicillin work? Well, amoxicillin is a semi-synthetic antibiotic that inhibits biosynthesis of cell wall mucopeptide. It has a broad spectrum of activity against both gram-positive and gram-negative organisms. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used for ear, nose, and throat infections, as well as with other medications used to treat H. pylori gastrointestinal tract infections. Infections of the skin and subcutaneous tissue may be treated with amoxicillin, as well as sinusitis. Infectious diseases of the genitourinary system may be treated with this medication, and there are also some other indications. With respect to contraindications or reasons we would not be able to prescribe amoxicillin, we wouldn't give this medication to a patient who had a hypersensitivity to amoxicillin, other beta-lactam antibiotics, or any other component of the formulation. Now what about dosing with amoxicillin? So as an example, if we were treating an infection of the skin or subcutaneous tissue and it was mild to moderate, we may see 500 milligrams orally every 12 hours or 250 milligrams orally every 8 hours. If the infection was severe, however, we may see 875 milligrams orally every 12 hours or 500 milligrams orally every 8 hours. In the treatment of Lyme disease, we may see 500 milligrams orally 3 times daily for 14 days, with a dosing range here of 14 to 28 days. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using amoxicillin, so I'll go over some of those here now. Greater than 1% of patients may experience a rash, while diarrhea may happen up to 8% of the time. Again, greater than 1% of patients may experience nausea or vomiting, and a headache may happen up to 7% of the time. Now, some more rare but serious side effects would be Stevens-Johnson syndrome, toxic epidermal necrolysis, or Clostridium difficile associated diarrhea. That's all we're going to talk about today with amoxicillin or Amoxil. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.